Good morning, my name is Sara Fernandez. My master work, which I am currently developing in my PhD, is about the biomechanics of pregnancy and childbirth. Consists of two parts. On the one hand, the validation of angle measurement as a non-invasive method for back curvature or lordosis in pregnant women, and on the other hand, the relationship of this angle and the result of childbirth. My research project is to look for a relationship between the change of the pelvis that occurs during pregnancy to keep us standing and the childbirth. I would like to know if this is the reason why it is more difficult for us giving birth than animals, as imaging techniques such as scanner and X-ray are normally used to study the spine, which are contraindicated during pregnancy. I wanted to find a way to measure this angle in a way that could be safe for pregnant women. Reviewing the literature, I found a study that developed a way to measure the angle by taking the widest measurement between a plumb line on a person's back and the lumbar area. These measurements were compared with the radiographic measurement method and were validated because it had a correlation of 95%. It is called arrow test. My general objectives are obtain a reliable and safe technique to measure lordosis angle. 2. Link lordosis angle to a birth outcome. 3. Design a training to correct lumbar curvature towards a beneficial position for childbirth. The study is an observational analytical study of 122 pregnant women over 35 weeks of pregnancy from 18 to 40 years old in a midwife room. I will explain how to do it. First, I will make the arrow test that I explained before. Then the stickers are placed on the anatomical landmarks. The anatomical landmarks are the last rib, greater trochanter, and anterosuperior iliac spine. After this, a photograph will be taken with a smartphone in full right profile of the pregnant woman. Next, we measure the angle with an angle application. Here you can discover the Y value of the angle corresponding to the X value of the arrow test. The next step is to do a correlation analysis between these values and the outcome of the birth. After all of that, we will be able to know if angle measurement through photography is as reliable as the arrow test. We will be able to know what angle determines the normal curvature with this method, and we will be able to know which angle is the most favorable to have a vaginal birth. And with all of this, we can focus on postural reeducation to facilitate the birth. Thank you for listening to my presentation.